Okay, it's Jeff Science here. Good morning, everyone, and thanks for joining what is a phone briefing today. We expect to return to our regular format next week. Today, Dr. Walensky will provide an Omicron in the U.S. update and discuss CDC's updated guidance for people who test positive for COVID. Dr. Fauci will discuss the latest science on Omicron. Before we turn to the doctors, I thought I would provide a brief update on the actions the administration is taking to ensure states, communities, and hospitals have the support they need in the coming weeks. For months, the Biden administration's whole of government surge response teams have been working hand in hand with governors and local health officials across the country to assess and address needs on the ground. More than 13,000 National Guard members have been activated in 48 states to support the COVID response, from vaccinations to testing to clinical care. These are state deployments that, thanks to the president's actions, are fully paid for by the federal government. Additionally, we have directly helped more than 30 states and territories by deploying over 2,100 federal personnel and thousands of ambulances, ventilators, and other critical supplies. On Monday, the president joined the administration's regular meeting with governors. It was actually our 40th meeting this year, to reiterate that we continue to stand ready to help them with more support for hospitals, more testing, and more capacity to get shots in arms. This includes an additional 1,000 military doctors, nurses, and EMTs ready to deploy when and where needed. Our message to governors around the country is simple. If you need something, say something, and we will mobilize to quickly get you the resources you need. And that's exactly what we've done over the past week or so. More boots and supplies have already landed on the ground. For example, in New York, 60 FEMA medical personnel and 30 ambulances arrived last week to help transport patients to hospitals around the state and balance patient loads. And in just 1 week, we've established 9 federally run testing sites in New York City, with 3 more sites opening this Sunday. In Arizona, 20 FEMA paramedics began providing clinical support across the state on Christmas Eve, with nearly 40 more medical personnel arriving next week to help administer treatments in Maricopa and Pima counties, as well as in tribal communities. In Indiana, 23 military medical personnel started their mission on Christmas Day at University Methodist Hospital in Indianapolis. In New Mexico, 15 medical personnel from the U.S. Public Health Service Commission Corps arrived on Monday to provide surge support in Indian country. Today, we're sending 15 ventilators to the state, and 12 federal medical personnel will arrive next week to help get more shots in arms. In Wisconsin, a 23-person military medical team is scheduled to start its support mission at Belen Hospital in Green Bay on Friday. In New Jersey, a new federally run free testing site will open on New Year's Day, and more sites will open across the next several days in Philadelphia and Washington, D.C. And on top of all of this, 1 million gloves, 342,000 masks, respirators, and face shields, and 40,000 gowns the administration has shipped for frontline healthcare workers in states in the past couple of weeks alone. So as you can see, we've been working around the clock to surge reinforcements to communities as they battle Omicron, helping to staff hospitals, administer monoclonal antibody treatments, transport patients, add testing capacity, and get more PPE to where it is needed. And you'll see us continue to act aggressively to address communities' needs in the days and weeks ahead. So with that, let me hand it over to Dr. Walensky. Dr. Walensky.
Thank you so much, Jeff. Good morning, everyone. I'd like to start by walking you through today's data. The current 7-day daily average of cases is about 240,400 cases per day, an increase of about 60% over the previous week. The rapid increase in cases we are seeing across the country is in large part a reflection of the exceptionally transmissible Omicron variant. In a few short weeks, Omicron has rapidly increased across the country, and we expect will continue to circulate in the coming weeks. While our cases have substantially increased from last week, Hospitalizations and deaths remain comparatively low right now. The 7-day average of hospitalizations admissions is about 9,000 per day, an increase of about 14% over the previous week. This could be due to the fact that hospitalizations tend to lag behind cases by about 2 weeks, but may also be due to the early indications that we've seen from other countries like South Africa and United Kingdom of milder disease from Omicron, especially among the vaccinated and the boosted. And the 7-day average of daily deaths are about 1,100 per day, which is a decrease of about 7% over the previous week. As you continue to watch these trends, I want to emphasize that this virus has proven its ability to adapt quickly, and we must adapt with it. And it is in that context that last week, CDC updated our isolation and quarantine guidance for healthcare workers as we prepare for an anticipated surge in COVID-19 cases. This updated guidance will help to ensure that hospitals, clinics, and long-term care facilities can safely stay open and remain appropriately staffed, both to handle hospitalizations from COVID-19 and to make sure that we continue to provide the necessary care for those experiencing heart attacks, strokes, and other illnesses. Swiftly thereafter, on Monday, CDC also updated its recommendations to shorten the recommended isolation and quarantine period for the general public. These updates to our recommendations were made to reflect what we currently know about COVID-19 infection, including how long a person is most infectious. Studies have demonstrated that when infection with SARS-CoV-2, people are infected with SARS-CoV-2, people are most infectious in the 1 to 2 days before symptoms develop and the 2 to 3 days after. After 5 days, the risk of ongoing transmission substantially decreases. Let me make clear that we are standing on the shoulders of 2 years of science, 2 years of understanding transmissibility, and a lot of information that we have gleaned from the wild type virus, as well as the Alpha and Delta variants, and more that we continue to learn every single day about Omicron. We do know the vast majority of viral transmission happens in those first 5 days, somewhere in the 85 to 90% range. So if a person can isolate for the first 5 days, they absolutely should. Many are asking, why do we not require a test at the end of the 5 days of isolation for those who are infected? We know that PCR testing would not be helpful in this setting, as people can remain PCR positive for up to 12 weeks after infection and long after they are transmissible and infectious. We also don't know that antigen tests give a good indication of transmissibility at this stage of infection. On the other hand, we know that after 5 days, people are much less likely to transmit the virus, and that masking further reduces that risk. And this is why people need to mask for 5 days after their 5 days of isolation. This science, as well as what we know about the protection provided by masking, vaccination, and booster doses, and about our test performance, were all part of what informed our updated recommendations. Let me walk you through exactly what these new recommendations mean for you. First, isolation refers to what you do when you have COVID-19, most likely diagnosed by a positive test. Isolation prevents those who are known to be infected from transmitting the virus to others. Quarantine, on the other hand, is different. This is what you do when you've been exposed to someone who has disease and are unsure if you yourself were infected. Quarantine prevents further spread of the virus in the time before someone may develop symptoms or from those who are asymptomatic from their infection. If you are infected with SARS-CoV-2, regardless of your vaccination status, you should isolate for 5 days. During periods of isolation, it's best for you to wear a mask around those in your household to avoid spreading the virus at home. After 5 days, if you're asymptomatic or if your symptoms have largely resolved, you may leave isolation as long as you continue to wear a mask around others, even in the home, for an additional 5 days. For those who've been exposed to COVID-19, quarantine recommendations are based on your vaccination status. If you are boosted or have been vaccinated with your Pfizer or Moderna series in the past 6 months, or your J&J shot in the past 2 months, no quarantine is needed. However, a mask must be worn for 10 days following your known exposure, And we also recommend getting a test on day 5 after your exposure. If you're not vaccinated, or you were vaccinated with your Pfizer or Moderna series over 6 months ago, or with J&J over 2 months ago, and have not yet received your booster, you should quarantine for 5 days following your last exposure. After 5 days, you should continue masking around others for an additional 5 days, and you should also get a test at day 5. If it's not possible for you to quarantine, it is really important that you do the right thing and wear a mask at all times around others for 10 days after your exposure. Here, we also emphasize that you should get a test at day 5. And if at any point you develop symptoms of COVID-19 during your quarantine period or your 10 days after exposure, like fevers, runny nose, a cough, headaches, or body aches, you should get a test and isolate until your test results return. And of course, then isolate if your test returns positive. Now, with these updates to our isolation and quarantine recommendations, I want to emphasize the critical importance of masking, which we know decreases the risk of transmission, as well as the importance of staying home when you're sick. If you're sick or have symptoms, it is best for you to stay home and to stay away from others. As we continue to fight COVID-19, prevention is truly our best option. This means for everyone 5 and older, getting vaccinated. And for those eligible, it means getting your booster shot. For everyone, it means continuing to follow our multi-layer prevention measures, including masking in public indoor settings in areas of substantial or high community transmission, washing your hands frequently, and testing before gathering when possible. How well each of these prevention measures is implemented, as well as adherence to isolation and quarantine recommendations, will determine the outlook in the coming weeks and months. We at CDC are working to provide updated recommendations using science to ease the burden of lengthy isolation and quarantine recommendations. However, these recommendations will only work if people follow them. As we look to the new year, I am hopeful that we can come together and do what is in the best interest of our loved ones, our friends, and our communities. So with that, I say thank you, Happy New Year, and I will now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. I'm going to concentrate my remarks predominantly on severity or not of this disease. But before I do, I just want to underscore something that we always talk about when we talk about severity, and that is the issue of transmissibility and immune evasion. So very briefly, we know now incontrovertibly that this is a highly transmissible virus. We know that from the numbers we're seeing, but I think each individual person throughout this country is now seeing around them the high degree of transmissibility. With regard to immune evasion, very clearly now we have a number of tests looking at the effect of Omicron on the evasion of immunity from monoclonal antibodies as well as from vaccine-induced antibodies. And clearly there is a degree of immune evasion, particularly against infection and to some degree against hospitalization. However, importantly, and the bottom line message here is that boosters bring back up that degree of protection to a level that is approximating what it was before. So boosters are critical in getting our approach to Omicron to be optimal. Now let's focus on the severity of disease. I'm going to review some preliminary observational clinical data as well as some selected initial laboratory data. First, the data from South Africa. There have been a number of reports. I'll report here one published yesterday from a large hospital in the Tshwane, South African district, added to an earlier report that is very similar. COVID-19 hospital admissions from the Omicron wave were compared to admissions from previous waves. And here is the comparison. In hospital deaths, 4.5 versus 21.3. ICU admissions, 1% from Omicron, 4.3 for others. 45% of patients required supplemental oxygen with Omicron compared to 99% in a prior wave. Length of stay, 4 days for Omicron, 8.8 days for the second wave. Mean average age 39 years for Omicron, 49 years for previous waves. The authors note in that study that the changing clinical presentation of SARS-CoV-2 is likely due to the predominantly high level of prior infection and to some extent vaccination coverage, since vaccine level is relatively low in the Republic of South Africa. Moving on to the United Kingdom. In a study of the UK Health Security Agency technical briefing, preliminary analysis was looked at from days November the 22nd through December the 19th. The risk of presentation to emergency care or hospital admissions with Omicron was 60% that of Delta. The risk of hospitalization admission alone with Omicron was 40% of that for Delta. These data were fortified by data from Scottish researchers that showed when analyzed data in the Scottish population from November 1 to December the 19th, preliminary data suggests that Omicron is associated with a 2/3 reduction in the risk of COVID-19 hospitalization. Another study from the UK, Imperial College UK report in the hospitalization risk, analysis of both clinical and laboratory data indicate an overall significant reduction in the risk of hospitalization for Omicron compared to Delta. In the United States, we are getting accumulation of data. The spike in cases is out of proportion to the increase in hospitalization. So if one looks at 14-day averages, the data as of last night indicate a plus 126% increase in cases and an 11% increase in hospitalizations. Now, we must remember that hospitalizations and deaths are lagging indicators. However, the pattern and disparity between cases and hospitalizations strongly suggest that there will be a lower hospitalization to case ratio when the situation becomes more clear. Just a word about children. Certainly, more children are being infected with the highly transmissible virus, and with that, there naturally will be more hospitalizations in children. It is noteworthy, however, that many children are hospitalized with COVID as opposed to because of COVID, reflecting the high degree of penetrance of infection among the pediatric population. The final conclusion about the level of severity in children remains to be determined. And finally, some in vitro and animal data, which address the issue of whether or not there is inherent lowering of virulence of the virus. In a study from Hong Kong, it was shown that although Omicron replicates faster than Delta in the bronchus, there's less efficient replication in the lung. Hamster models from the University of Tokyo show that Omicron poorly infects and spreads in the lung and is less pathogenic compared to Delta in a hamster model. Belgian researchers in Syrian hamsters see the same thing. NIH-funded studies that are ongoing right now in both mouse and hamsters confirm the lesser virulence in the animal model, and studies here at the Vaccine Research Center at NIH in the non-human primate model are ongoing and will await results of that. So in conclusion, the data are encouraging, but still in many respects preliminary, yet they are getting stronger and stronger as additional data are accumulated. And it is still unclear how these data will translate to other demographically diverse populations in the United States and elsewhere throughout the world. But having said this, all indications point to a lesser severity of Omicron versus Delta. It is difficult to determine what degree of lessened severity is due to pre-existing immunity or the intrinsically lower virulence of Omicron as suggested by the animal studies, or a combination of both. Increased transmissibility of Omicron resulting in an extremely high volume of cases may override some of the impact of the lower disease severity. And so we should not become complacent, since our hospital system could still be stressed in certain areas of the country. And so to repeat what we say so often, and it deserves reemphasis, the risk of severe disease from any circulating variant, including Omicron, is much, much higher for the unvaccinated. And so adults and children who are eligible get vaccinated, and vaccinated people get boosted when eligible.